Have you ever felt persistently sad, empty inside, hopelessness, or guilt? Have you ever been extremely tired or lose interest in your favorite hobbies and activities? If yes, you may have been or are in a state of depression and anxiety. Some may be in denial and not want to admit they have the symptoms of this mental disorder. It has become more and more common these days for people to develop such an illness due to high stress, loss of job, or even a family member. A traumatic event could happen in their life that causes such a state of depression and can never go away. I am someone who has been dealing with depression for over a decade. It got worse after I experienced a traumatic situation 8 years ago, that it still affects my relationships with others. I have a hard time trusting people. My anxiety has gotten worse. Anxiety has been part of my disorder as well. It causes nervousness, lack of social, hard to breathe. So what are the differences between each of these? We hear them all so much lately. For anxiety, it can cause interference with your daily life. More than 3 million cases per year are diagnosed with it. Some of the things that you can feel are a state of panic, sweaty, palpitations, chest pain, and feeling like you're choking, and you become very overwhelmed. Some of these are normal. If you are feeling this way on a daily basis when you're taking a test, you are trying to deal with a difficult situation, or make an important decision. Everybody has anxiety when you're dealing with those kind of things. But when you are feeling this way all the time, it is considered an anxiety disorder. 60% of women are more likely to get anxiety. 18% of Americans struggle with anxiety every day. 23% are diagnosed with a severe case of anxiety. Depression, also more than 3 million cases per year. It's a mood disorder. It can last for a long period of time. To be diagnosed with it, it needs to at least last 2 weeks at a minimum. And that's when they can kind of tell if you have depression or not. Some of the things that they look for or that you are going through is a loss of interest and, or pleasure in any of your kind of hobbies, decreased energy or fatigue, feeling restlessness, difficulty concentrating, or having a hard time remembering things. It even goes as far as death or suicide. Some may have all symptoms or just a few. If you have only a few, it doesn't matter. It's still a disorder, a very serious disorder. Women are more likely to get depression, 74% compared to 65%, which is men. Older people are more likely to get depression. It starts in your adulthood and gets more and more common as you get older. But it can start when you are a teen. So don't think that, that's not possible if you're a teenager. It's very likely. Especially with all the peer pressure and how the world is changing. Teens are becoming more and more likely to have depression. So how is it treated? How can you recover from it? Most of the time, people get on medications to get through each day. There are many different kinds of medications, because some of them affect people differently. Some don't work for some people when they work for others. Usually you have to try one out for a few months in order to see if it is helping your moods, helping you be more stable with your anxiety, your moods being deep down. Getting off meds can be hard. I have tried. There are side effects that are sometimes worse than the actual symptoms of the disorder. They can cause dizziness, irritability. It is bad. It can get very bad. It's to where you can't even focus. It's hard to drive. Your eyes become fuzzy. So sometimes being off meds is not the right way to do. Always talk to your physician first. But it is possible. just make sure to always have someone to talk to about it. Don't ever hold it in. Don't be ashamed. So many people are going through it that somebody else might be able to help you as well. So in conclusion, I just want to say, when we see people going through this, don't judge them. We don't know their situation. We don't know what they have been through or what they're going through. The best thing is to be their friend and find out if there's something you can do. If it's something that's really, really serious, talk to a doctor. Don't be ashamed. Everybody goes through it. Some people don't, but a lot of people do. Doesn't matter if it's a small symptom or not. It can be dangerous. Any kind of depression.